Hi everyone, I'm Dr. Patrick, a real doctor, and today we are diving into one of the most iconic medical shows ever, Doctor House. I hope everyone who is watching my YouTube channel, my video, had been accounted or watching Doctor House film, but is it medically accurate? Could a real hospital survive his style? Do you think a real hospital can survive Dr. House's style? You can write in the comment. What do you think? Remember to subscribe for more video. So let's find out. So if you watch the Dr. House film, it looks like now that it was cool, but could that actually happen in real life? So let's break it down. Do you know that Dr. House was doing or getting dramatic diagnosis? So what do you think? For example, for the clip, Dr. House gets an irregular hair diagnosis from only one thin symptom. Is this possible? What do you think? For me as a doctor, I hope even one of the intelligent doctor can't do that. To get the irregular hair diagnosis from one thin symptom, it's impossible. For diagnosis of rare diagnosis, symptom is not enough. You have to have many tests, laboratory tests, imaging tests, and so on. So to rely on the one diagnosis like how Dr. House was doing in his movie, it's impossible. In real life, we rely on a truth test and protocol for diagnosing a disease like, for example, the disease known as Wegener's granulomatosis in 30 seconds. Not quite. So this is impossible. You have to have the symptoms and you have to have the approach for those symptoms, like using the term, or like to have the different diagnoses known as differential diagnosis, workup, and even the laboratory imaging. So you can read on up-to-date articles on differential diagnosis, how you have to list many diagnoses once you have a symptom, and then you account, or you have to take one after doing a laboratory investigation. So the risk of treatment, as you saw in the Dr. House movie, Dr. House was making risk treatment. This is not accepted by ethical in medicine nowadays. But in that movie, Dr. House was doing it. Like the movie where Dr. House injects a patient with a random drug or shock them without consent. This can't be done in nowadays in medicine. You can't inject a drug or shock a patient without a patient consent. For any treatment or injection or shock, you have to get consent from the patient. But Dr. House was doing it in his movie without consent from the patient. So nowadays, to do it, we have to have consent. So this would be a lawsuit in real life and probably a suspension. Dr. House should be suspended from his practice because he was doing things without consent. To inject a patient with a random drug, you don't know it, and shock them without consent. So the importance of informed consent, it's legal, it protects the healthcare provider. And remember also in the hospital, have hospital ethical committee which control those activities that was being done by Dr. House, where he was injecting a patient with a random drug or shock them without a consent. So hospital ethical committee should approve this. How treatment guidelines are based on evidence, not genius guess. This is how. In the hospital, you have a different guideline to guide the treatment. And if a doctor is doing something, it should be based on what written in that guideline that is being followed in different hospitals. Not genius guess as Dr. House was doing it. Not. This is impossible. This can't be done in real life. You can read on the New England Journal of Medicine and Treatment Ethics and even WHO clinical guideline. So the genius doctor myth. Let's talk about the myth of the lone Genesis doctor. Medicine is a team sport. You can't do medicine alone. You have to work as a team. While Dr. House was working as alone, as a genius doctor alone. So now you have to have a nurse which are active, lab technician active, radiologist active, resident and essential. So in real life, no one works like a house without major consequence. You can't do that what Dr. House was being done. Doctor don't break the law to heal patient. You can't. And if you do that, you will be punished by the law. So you have to read that more on American Medical Association Code of Ethics. So what they got right? At least Dr. House correctly diagnosed a rare autoimmune disease. Okay, that's good. That part was impressive. In medicine, rare diseases do happen, but they are rare for a reason. So, proper medical terminology, you have to focus on the pathophysiology, diagnostic logic when it's realistic. So, Dr. House makes great TV, but real medicine is more evidence-based, collaborative, and careful. So let me know if you want me to react to another medical series like this one. Subscribe for more reaction from a real doctor like Dr. Mike, but with an African twist. See you next time. Hi everyone, I'm Dr. Patrick, a real doctor, and today we are diving into one of